Attention! If you are receiving Social Security SSI or SSDI, please pause what you are doing and watch this video immediately. Millions of American seniors have just received some of the most important updates in recent years. And if this information has not reached you yet, you could be missing out on important financial support. Congress recently enacted major legislation that is directly affecting your Social Security benefits, SSI payments, and SSDI checks. In addition, targeted relief payments are being issued, and certain groups of seniors qualify for these funds that they may not be aware of yet. Could this apply to you? Here is the latest information we have. Benefit levels are being modified, payment dates are receiving updates, and thousands of seniors throughout the country are already wondering, when will my funds arrive? How much will I receive? Is there anything I need to do to get it? We have carefully reviewed every section of this new legislation, so you do not have to. Whether you are 62, 70, or any age in between, whether you receive Social Security retirement, SSI, or SSDI, this video explains precisely what these updates mean for your finances in clear, straightforward language. No complicated official terms, no unnecessary complications, because you deserve straight facts about your money. If you want to help every senior in America learn this valuable information, please tap that like button right now, and let us spread this news to everyone who needs it. And welcome back, everyone. If you are watching our channel for the first time, you have come to exactly the right spot. And I want you to understand that what we are discussing today is something that every single individual receiving Social Security, SSI, or SSDI across this nation should listen to carefully. This is not hype. This is not overstatement. What Congress has recently accomplished is factual. It is meaningful, and it is going to directly influence the funds that reach your bank account or come in your mail. So please get settled, make yourself comfortable, and let us review every single detail together, because you deserve to fully understand exactly what is occurring with your benefits and your hard-earned money. Now, before we dive into the details of what was recently enacted and what it means for you personally, I want to take just a moment to recognize something important. Many of you have experienced an extremely difficult period financially. The price of groceries has increased, your utility bills have risen, prescription medications cost more than before. And for millions of seniors and disabled Americans who rely on Social Security as their main or only source of income, every single dollar counts in a way that most politicians in Washington simply do not fully appreciate. So, when updates like this appear, updates about possible increases, relief payments, and new legislative measures, it is completely understandable to feel a combination of hope and caution. I understand completely, and that is precisely why we are here today. To sort through all the confusion, present the facts directly, and assist you in understanding what this truly means for your life. So let us begin at the start. Congress has faced considerable pressure for quite some time from advocacy organizations, from senior groups, from disability rights supporters, and honestly from millions of everyday Americans who have been sending letters, making calls, and attending town halls requesting action. The cost of living has been pressuring people on fixed incomes for years, and the requests for assistance have grown stronger with each passing month. And now, after thorough discussion, bargaining, and resistance from various sides, a new bill has successfully passed through Congress and become law. And what this law contains is going to be extremely relevant to you. Let us discuss Social Security first, since that is what most of our viewers rely upon. The new law contains measures that directly affect how Social Security benefits are determined and modified. One of the most important elements of this legislation addresses the cost of living adjustment, or COLA. Now, most of you already understand what COLA means. It is the yearly modification made to Social Security benefits to help match inflation. But here is the issue that millions of seniors have raised for decades. The method used to calculate COLA has not accurately captured the actual expenses that older Americans encounter each day. The existing formula relies on something called the CPIW, which tracks the spending patterns of urban wage earners and clerical workers. Here is the reality. That does not describe you. That does not match the average Social Security recipient. Seniors allocate a much larger share of their income toward health care, prescription drugs, housing, and food. and those expenses have increased faster than overall inflation for years. What this new law accomplishes is taking important steps to correct that basic inequity. The legislation contains wording that moves toward adjusting how these modifications are determined, with increased focus on the true spending habits of individuals age 62 and older. This is an issue that advocacy organizations like the Senior Citizens League and AARP have supported for many decades. And while the complete shift to a new formula will not occur immediately, the path forward is evident, and the purpose is clear. Your benefits should match your actual expenses, not the expenses of someone who is 35 years old and employed in an office. But that represents only one element of what was enacted. Let us discuss something that has created considerable conversation and interest in our community: the relief payments. Now, I realize that term relief brings to mind the pandemic period payments that were distributed in 2020 and 2021. And some of you may be asking if this resembles that. Well, here is what you need to know. These payments are focused, meaning they are specifically created to assist individuals on fixed incomes, who have been most affected by inflation and increasing costs. And Social Security recipients, SSI recipients, and SSDI recipients are clearly among those this assistance is intended to reach. The specifics of how these payments will be organized and delivered are essential to understand. So, let us go through them step by step. For individuals currently receiving Social Security retirement benefits, the payment is intended to serve as additional assistance in addition to your regular monthly benefit. The Social Security Administration, the organization responsible for managing these payments, will utilize the records they already maintain for you. In most situations, you will not need to take any action to obtain this payment. If you are already enrolled in direct deposit, which applies to the large majority of Social Security recipients, the funds will deposit directly into the same bank account that receives your regular benefit. If you receive a paper check will be prepared and sent to your recorded address. Now, for those of you receiving SSI, Supplemental Security Income, there are some particular details worth noting. SSI recipients rank among the most financially challenged individuals in the country. Many of you receive SSI because you are older and have very limited income and assets, or because you have a disability that stops you from working, and you lack sufficient work history to qualify for regular Social Security. The new law specifically contains measures to make sure that SSI recipients are included. The payment levels for SSI recipients are organized to consider the lower base benefit amounts that SSI provides compared to regular Social Security retirement. So, the assistance is appropriate and substantial. For SSDI recipients, that is Social Security Disability Insurance, the situation is equally significant. Millions of Americans receive SSDI because they became disabled before reaching retirement age and are unable to work. Many of these people live on very limited budgets, handling medical costs, and facing conditions that make every single day difficult. The legislation identifies SSDI recipients as a key group for assistance, and the payment organization reflects that priority. If you are receiving SSDI, you should look for information from the Social Security Administration in the coming weeks. They will be distributing notices by mail and through your online My Social Security account, if you have created one. Speaking of the My Social Security online account, if you have not created one yet, I want to strongly recommend that you do so. Visit SSA.gov and find the choice to establish a My Social Security account. It is free, it is protected, and it provides you immediate access to your benefit details, your payment record, and any notices or updates that the SSA directs to you. During a period like this, when significant updates are being put into place, having that direct connection with the SSA is truly helpful. And if you are not comfortable handling it on your own, ask a reliable family member, a friend, or even your local library. Many libraries have employees who can assist seniors with creating online accounts securely. Now, let us cover something that I know concerns many of you, and that is the matter of taxation. Specifically, will these relief payments be taxable? This is a very important question because for many seniors, even a small addition to income can change your position regarding how much of your Social Security is subject to federal income tax. Under existing rules, if your combined income goes above certain levels, up to 85% of your Social Security benefits can be taxed. the levels are fairly low and have not been revised in decades, which means more and more seniors have been affected by this over time, even though they are not considered wealthy by any standard definition. The positive news, based on the legislative wording that has been examined, is that these focused assistance payments are organized in a manner that should not be counted as standard taxable income in the usual way. However, and I want to emphasize this point, you should definitely speak with a tax expert or reach out to the IRS directly to verify how these payments will apply to your individual tax circumstances. Do not depend only on what you see online, including from this channel. Obtain specific guidance from someone familiar with your complete financial situation. Now, let us discuss another element of this legislation that has received less notice, but is equally significant. And that is the modifications being made to the earnings limit for individuals who are between 62 and full retirement age and continue working while receiving Social Security. Under the previous guidelines, if you were collecting Social Security before reaching your full retirement age and you continued working, your benefits could be temporarily decreased if your earnings went above a specific amount. For many seniors who work part-time to add to their Social Security income, this has created a genuine financial challenge. The new law increases that earnings limit considerably, which means you can earn more from employment without having your Social Security benefit decreased. This is truly transformative for the portion of our audience who face that circumstance. If you are 63, 64, 65 years old collecting Social Security, but also working a part-time job to cover expenses, you now have considerably more flexibility. You can earn more, retain more of your benefit, and worry less about unintentionally causing a reduction. And while we are discussing working seniors, the law also contains measures that improve safeguards against age discrimination in employment. Now, you may be wondering, what does workplace discrimination have to do with Social Security and relief payments? And the response is that it connects completely, because financial stability for seniors involves more than the payments that come from the government. It involves the opportunity to keep participating, working, and earning if you decide to and are capable of doing so. Improving safeguards for older employees means that if you are 68 years old and you wish to work, your employer cannot force you out simply due to your age. That type of protection provides people with options, and options lead to improved financial results. Let us now dedicate some time to discussing what this means, particularly for people with disabilities. The disability community in America has advocated for recognition and support for many years, and the SSDI measures in this new law represent an important recognition of the specific difficulties that disabled Americans encounter. One of the most valuable modifications involves something called the Substantial Gainful Activity Threshold, or SGA. The SGA is the amount of money you can earn from work each month before the Social Security Administration views you as no longer disabled for benefit reasons. If you earn above the SGA amount, your SSDI benefits can end. For years, this limit has been too low, and it has produced a situation where disabled Americans who wish to attempt work, even part-time, even in a restricted way, fear losing their benefits if they earn slightly too much. The new law raises the SGA limit substantially, providing SSDI recipients greater opportunity to consider work possibilities, contribute to their communities, and add to their income without the ongoing worry of losing their health coverage and disability benefits. This is extremely important for people with conditions like multiple sclerosis, lupus, heart disease, diabetes-related issues, and mental health conditions. People who may have some ability to work on their better days, but cannot maintain full-time employment. Providing these individuals greater flexibility is not only good financial policy, it is compassionate policy, and it shows an increasing awareness in Congress that the previous strict guidelines were causing genuine difficulties for genuine people. Now, I also want to spend a few minutes discussing something that impacts a large number of our viewers, and that is the connection between Medicare and Social Security. As many of you know, if you receive Social Security and are also enrolled in Medicare Part B, which covers your doctor visits and outpatient services, your Medicare Part B premium is usually taken directly from your Social Security check. And for many seniors, when the Medicare premium rises each year, it can consume most or all of the COLA increase, leaving you with little to no real gain in your net benefit. This situation has been known as the hold harmless provision, and it has disappointed seniors and supporters for years. The new law contains measures intended to build a more effective separation between Medicare premium increases and Social Security benefit increases, so that an increase in healthcare premiums cannot entirely cancel out a cost of living adjustment. This means that when your COLA increase arrives, you are more likely to actually notice that money in your monthly payment, instead of seeing it absorbed by a higher Medicare premium. I also want to respond to some of the questions we have received about Medicare drug costs, because this relates directly to the financial health of seniors and people on disability. Many of you are managing the heavy burden of prescription medications. You may be limiting pills, missing doses, or facing difficult decisions between purchasing medication and purchasing food. The new law continues earlier efforts to further increase the government's capacity to negotiate drug prices directly with pharmaceutical companies. This is meaningful. When Medicare negotiates prices, the reductions go directly to people enrolled in Medicare Part D, your prescription drug coverage. The number of drugs now included in negotiation has grown, and the reductions for participants are expected to be significant, especially for some of the most frequently used medications among seniors and disabled individuals, including drugs for heart disease, diabetes, and autoimmune conditions. Let us also discuss something that does not receive enough attention, and that is the financial effect of caregiving on seniors and their families. Millions of older Americans are not only managing their own finances, they are also assisting adult children, grandchildren, or other family members. And on the other side, millions of seniors are being supported by family members who have left work or decreased their hours to give that care. The new law contains moderate but meaningful measures to assist family caregivers, including measures that permit certain periods of unpaid caregiving to be included in the Social Security benefit calculation formula. This is especially important for women who have traditionally handled most caregiving duties and have therefore received lower Social Security benefits because those caregiving years were not included in their earnings record. Any progress toward recognizing caregiving is a positive step, and supporters hope it will grow in future legislation. Now, I want to be straightforward with you about something, because I believe you deserve honesty above everything. Not every part of this legislation is flawless. There are measures that advocates hope to include that did not reach the final bill. There are benefit increases that some groups believed should have been greater. There are people in particular situations, particularly certain categories of non-citizen legal residents, certain groups of public employees in some states, and individuals in specific transition situations with their benefits, who may not be completely included by every measure of this law. The legislative process is complicated and imperfect, and compromises occur. What was enacted is truly significant and shows real advancement, but it is not the end. Advocates are already preparing for the next legislative effort, and your voice, your letters, your phone calls, your votes will continue to be very important in forming what happens next. For those of you who are curious specifically about timing, when are these payments arriving? When will the changes begin? Here is what we know based on the implementation information that has been provided. The Social Security Administration has been instructed to put the changes in place on an accelerated schedule. The supplemental payments are expected to start being distributed within the next several weeks for those who receive direct deposit, with paper checks to follow on a staggered schedule soon afterward. The benefit calculation modifications and adjustments to the earnings limits and SGA thresholds will begin at the start of the next applicable benefit period, and the SSA is updating its systems as needed. Notices will be sent to beneficiaries describing the specific modifications to their individual benefits and what to anticipate. If you have not received a payment or a notice within the expected period, the most straightforward action is to contact the Social Security Administration directly. Their main national toll-free number is 1-800-772-1213, and for TTY users, it is 1-800-325-0778. They are available Monday through Friday from 8 a.m. in the morning to 7 a.m. in the evening Eastern Time. You can also go to your local Social Security office in person if that works better for you. And I know for many of our viewers, talking with someone in person feels much more comfortable than handling things online or over the phone. Both choices are open to you, and the SSA staff are there to help you understand your specific situation. One final thing I want to cover before we conclude, and that is the matter of scams. Friends, whenever updates like this appear, updates about relief payments, updates about benefit modifications, updates about checks being issued, scammers become active. They view seniors as targets. They will telephone claiming to represent the Social Security Administration and say that you must confirm your information to get your payment. They will send messages with links requesting that you click and supply your Social Security number and banking information. They will even appear at your home in some instances. Please listen carefully to this. The Social Security Administration will never telephone you and request your Social Security number over the phone. They will never ask you to pay a charge to receive your benefits. They will never require that you confirm your banking information by clicking a link in an email. If you receive any contact like that, end the call, remove it, and if you want to confirm the status of your payments, call the official SSA number yourself or visit SSA.gov directly by entering it into your browser. And please, pass this warning along to your friends and family. Scammers depend on people feeling eager about incoming funds and lowering their defenses. Do not allow them that chance. The main point today, friends, is this. Congress has listened to the concerns of millions of seniors and disabled Americans. And while the effort for complete financial stability and dignity in retirement and disability continues, what was recently enacted represents real practical assistance that is heading your way. Whether you are receiving Social Security retirement, SSI or SSDI, whether you are 65 or 85, whether you live in a large city or a small rural community, these modifications were created with you in mind. Your benefits are going to better match the actual costs you are experiencing. Your payments are going to include additional assistance. Your opportunity to work without penalty is being broadened, and your prescription drug costs are going to be handled more effectively than before. These are not minor matters. These are important advances toward the type of financial stability and respect that every American who has contributed to this country over a lifetime of work and service truly deserves. We will keep bringing you updates as the rollout continues, as payment dates are finalized, and as any new information comes from Washington. This is a developing situation, and we are going to remain current on every single update for you, because that is our purpose. You are not alone in dealing with this. You have this community, you have one another, and you have this channel dedicated to delivering you the facts, the specifics, and the practical advice that helps you maximize every dollar you have coming to you. Thank you so much for sharing this time with us today. Take care of yourselves, watch out for your neighbors, and we will see you in the very next video.